I think one of the greatest things about Riley being on the IU School of Medicine campus is opportunity. There's possibilities within basic science, within clinical research, health services research, precision genomics, public health. I mean, the list is endless.
People who go into this field want to do it for the right reasons, and everybody is happy and kind, and really the camaraderie that comes with this field and these very sick children is something you can't really replace.
The first year of Hemonc Fellowship is heavily focused on clinical care, and the idea of that is to really give fellows a vast experience in multiple aspects of hematology and oncology.
Learning how to diagnose, consent, and treat individuals with different blood and cancer disorders. We also have them doing a weekly continuity clinic so that they're building their own basis of patients.
But it's also about helping to understand what it is that really gets them excited, that they're really passionate about.
We really support our fellows doing a lot of different types of electives to really help them in their career. And this ranges anywhere from, dedicated hematology clinics, sickle cell clinic, stroke clinic, hemophilia clinic, to neuro-oncology, multidisciplinary clinic, neurofibromatosis clinic at the Short Center, looking at adolescent and young adult patients, blood bank, pathology, immunology, as well as any sort of rotation that we can offer here at Riley or at Indiana University.
I actually got interested in patients with sickle cell disease and thalassemia pretty early on. And through fellowship, I realized that there was even more that we needed to learn about in sickle cell. There are a lot of trainees who come into fellowship who haven't cared for very many sickle cell patients, but during that first year, their exposure to that significantly increases. And oftentimes, that very exposure is what makes them realize, wow, this is really exciting, and I am really passionate about sickle cell disease. Our transplant colleagues participate in CAR T therapy as well, so now you have trainees who are being exposed to something only a few programs around the country are doing. And so that vast clinical experience allows them to better care for their patients once they complete their fellowship training.
As you move into the second and third years, those are heavily research-oriented years. And so we do continue continuity clinic, and you do continue to care for your patients that are on your panel, but your focus is mainly on research.
Telemedicine was a unique opportunity that IU had already started to use with various populations, but it was still pretty new. It was new around the country. But with a lot of support from my mentors and our Department of Pediatrics, we were able to start that for our sickle cell patients. And almost immediately we saw a drastic change in patients being able to attend appointments, patients being able to start various therapies and stay on them, and eventually patients and families just feeling good about the fact that they could access the care they knew their child needed.
I would say one of the biggest things that I really look for is somebody with a love of medicine and a love of patient care. To cherish those moments with the patient is important, because at the end of the day, that's what we're all working towards, is a cure and a ability to help our patients live healthy, happy lives.